the facts defeat fear because the reality is reassuring. It is deep breath time. First of all, this is not our first rodeo with this type of situation in New York. 1968, we had the Hong Kong flu. 2009, we had the swine flu, where we actually closed like 100 schools in New York State. Avian flu, Ebola, SARS, MERS, measles, right? So we have gone through this before. When you look at the reality here, about 80% of the people who are infected with the coronavirus self-resolve. They have symptoms. The symptoms are similar to what you would have with a normal flu. And for most people, they treat themselves, over 80%, and the virus resolves that way. About 20% get ill. The mortality rate is estimated to be about 1.4%. 1.4%. What does that mean? The normal flu mortality rate is about 0.6%. And the CDC says 1.4, but they're extrapolating from what we know from countries around the world. First, even on the 1.4%, again, that tends to be people who are debilitated, senior citizens, many of whom have an underlying illness. That tends to be the people who are vulnerable to this. Good news, children do not appear as vulnerable to this virus. Less vulnerable than to the normal flu. So that is good news. But 1.4%, that's extrapolating from China and other countries. 80%, it'll resolve on their own. The woman who is now tested positive, she's at home. She's not even in a hospital. So the perspective here is important. And the facts, once you know the facts, once you know the reality, it is reassuring. And we should relax because that's what's dictated by the reality of the situation. I get the emotion. I understand it. I understand the anxiety. I'm a native-born New Yorker. We live with anxiety. But the facts don't back it up here. Also, we're extrapolating from what happened in China, other countries. We have the best healthcare system in the world here. Excuse our arrogance as New Yorkers. I speak for the mayor also on this one. We think we have the best healthcare system on the planet right here in New York. Amen. So when you're saying what happened in other countries versus what happened here, we don't even think it's going to be as bad as it was in other countries. We are fully coordinated. We are fully mobilized. This is all about mobilization of a public health system, getting the testing done, getting the information out, and then having the healthcare resources to treat people who are going to need help. Again, that is going to be primarily senior citizens, people who are debilitated, and we're going to have a special effort for our nursing homes, etc., congregate facilities where senior citizens are being treated. And I can't thank our partners enough. Everybody is doing exactly what we need to do. We have been ahead of this from day one. From day one. It was a big break when the federal government allowed us to do our own testing because now we are actually in control of the system ourselves.